let's face it, most of us want to change something about our bodies. So what if you could shape up that problem area in just an hour or two? We looked into a procedure that gets you in and out with less risk to your health and your wallet. Liposuction has gotten a bad rap. One study reported 1 in 5 patients dies during or after surgery, mostly due to complications with anesthetic. So doctors got to work on a new procedure that's not only safer, but quicker and cheaper. The tumescent procedure was developed by a Southern California dermatologist, and it allows a patient to literally walk out of the office by herself at the end of the surgery. Dr. Nowak, also a dermatologist, has performed dozens of tumescent liposuctions.
We're able to remove the fat. There's no longer this weight pulling down on this area, and her skin is able to adhere back in place. Creating results like this: a woman's thighs before and after, and another patient's stomach before and after liposculpture. The tumescent procedure has been shown to be very safe. Safe because there are few drugs involved and patients have a lower risk of bleeding. Only smaller areas are treated at one time, and it's cheaper, $2,000 to $5,000, because there are no general anesthesia or hospital fees. You can go ahead and hold your arm straight out there. The area that we can pinch underneath here is what we're going to be working with. After trying all the diets and workouts in the book, Leticia wanted to knock out her nagging problem areas once and for all. So last year, Dr. Nowak worked on her midsection. Take a look at those results before and after one treatment. The incision's only going to be about that big. We try to keep them as small as possible. Leticia's back, this time to have her arms done. It'll take about an hour and a half. And we're going to go ahead and start your procedure there. Okay, are you ready? Dr. Nowak uses a standard liposuction instrument, the cannula. You can kind of think of that as like a little straw that reaches us underneath the skin to remove the little fat deposits. But couples it with a new technology. A machine that motorizes the sucking action, making the procedure easier and giving the patient the sensation of a massage. But they are awake during the procedure. They talk to you. They walk out of here under their own power. It's a real exciting procedure. Afterwards, Leticia will rest for a while, then head home. Tomorrow she may have some pain, but the doctor wants her to get moving. More circulation and a compression garment will help her new look take shape. I've had people the next day go walking at the mall because they were out shopping for new clothes that they were smaller. 2 weeks later, that's exactly what Leticia is about to do.
I feel like a new person.
She says her friends and family are amazed.
Well, my clothes now fit the way they were supposed to, not like tight where like you have to pull everything up.
Remember Leticia before the liposuction? Well, here are her arms after. There's a significant reduction in the size of these areas. Looks great. Not everyone bruises, but Leticia's black and blue marks should fade completely within a couple of weeks.
My expectations were exactly what I got, a drastic change.
Leticia was back to work after a couple of days and says she's motivated to keep her new figure by working out and eating right.
I'm all for immediate results, and I've had them.
Now remember, there is risk associated with any plastic surgery. Our station does not endorse any particular doctor or procedure. You will find much more helpful information at kswbtv.com.
Remarkable change.
Amazing.
She was very excited about it. She was very happy, and she did really, drop some dress sizes and everything.
Yeah.
So.
Hey, no waiting.
And when you've got weather like this, you can go outside and you can keep it off, and it's great.
Absolutely. Not that we advocate working out at night, especially by yourself. You know, it's dark. You want to be very safe. But tonight, an excellent night to